This is a targeted drug, something called PSMA, prostate-specific membrane antigen, and that's expressed in about 90% of prostate cancer specimens. So what this is a conjugate using MME, which is an antitubulin agent, and the reason why these drugs have not really been tried in the past or have not gone further is that the conjugates have not been as strong, and this is a very, very strong linker between the antibody and the cytotoxic agent. So it's a way of delivering chemotherapy or a cytotoxic agent to prostate cancer cells more specifically. So this is an antitubulin called MME. What we did was we looked at patients who had previously progressed on docetaxel treatment, also abiraterone as well as enzalutamide. They may have received cabazitaxel, another chemotherapeutic drug, and we evaluated this drug in patients. We found actually some interesting response patterns. We confirmed our initial toxicity data in the phase 1 trial, and we established that 2.3 milligrams per kilogram is the recommended dose. And we also saw responses in patients, particularly those who have had low neuroendocrine markers, as well as those patients who have high levels of PSMA expression in circulating tumor cells. So we're beginning to refine which patients are the right ones to evaluate with this treatment. This is an active drug as a second-line agent for castrate-resistant prostate cancer. What we're now doing is moving this up earlier, and we're looking at this drug as an agent in taxane-naive patients who've not received prior chemotherapy. So I think we'll have a more robust signal from those particular patients, and also a better assessment as to how this drug may fit into the prostate cancer armamentarium. It's a targeted way of delivering cytotoxic agents, and this is an approach that has not been used in prostate cancer. We've been targeting the androgen receptor with great success, but now we're moving on to other areas that are more specific and hopefully will lead to better, more effective, and less toxic drugs. The take-home message is that patients should be enrolled in clinical trials, and this is again how we're going to move the field forward, and that PSMA therapy is an active target for prostate cancer. Well, certainly we've got new drugs that are in the armamentarium, but we're not curing metastatic patients. And as we develop more understanding of the biology, we'll be able to sort out who should go on what treatment more effectively.